Hello, and welcome to this edition of Let's Talk, presented by the Visiting Nurse in Hospice for Vermont and New Hampshire. My name is Anthony Knox, and I'm the Community Relations Manager for the Visiting Nurse in Hospice today. And unlike other presentations that I do, today is actually just me talking about all of the great home health and hospice services that are available to you or someone that you know, right from the comfort of their own home. So we are going to just dive right into to the presentation today. All right. So again, we're introducing VNH as well as just all the services that are available to you within your home. And just to begin, our mission and focus, the number one thing is that we would just want to provide the best possible services to individuals within their own home. We know that people have a tendency to get better being able to be in their own home. Also, the exercises and stuff that you learn while you're doing physical therapy, occupational therapy, speech therapy, things like that, don't always necessarily translate from an outpatient setting into the home setting. So, we're able to be in the home and help you understand what needs to be done so that way you can get better and that you can get back to more of a baseline. We serve about 140 towns throughout Vermont and New Hampshire, and on our next slide we'll show you the service map that we have. And the biggest part of everything is that our goal is just for helping people. This could, you may not have insurance, you may not have the finances in order to pay for medical care, but we just want to ensure that you are able to get the care that you need, so that way you can get back up on your feet. So as you can see, our territory map here is very expansive in Vermont. We cover all of Windsor and Windham counties, and then we start branching into Orange County and a little bit of Rutland County, and even a little bit down there in Bennington County. We are always ensuring that we're providing the best quality care and the safest quality care possible to an individual. And so we just want to make sure that that individual is getting the best care possible, and that they're able to get back up on their feet. And also, as you can see, there's a little bit of New Hampshire that we also cover in our service region. So we have a variety of programs that are available for individuals from birth, all the way through the end of life care. And so, we provide home health care, which includes skilled nursing, physical therapy, occupational therapy, and speech therapy, as well as providing medical social work and home health aides for those individuals that need either of those. We also provide hospice care, all of the end of life care for an individual, which can also include social work and our chaplaincy program and volunteers. And again, we'll talk about all those as we get to hospice. We also offer long-term case management for those individuals who are trying to stay in their home as long as possible. We were able to provide some support to help have well-rounded supports for that individual to be able to live in their home as long as possible. We also have a help at home a program that is it's more of a fee-for-service support for individuals that helps with some basic supports around the home and even out in the community. And finally, we have a maternal child health care program that does a lot of the similar features of the rest of our programs, but these are more directed for children. So as we get to that, we'll be able to talk a little bit more about it. So to start our home health care skilled nursing part, so our nursing staff are able to help individuals with a variety of different reasons, but most commonly around an injury and illness, having a recent surgery, or even some complications related to chronic health conditions. So for that individual who may need some supports with understanding chronic conditions that they're now going to have for the rest of their life. we're able to come in and provide some training and education and some support within the home, so that way the individual has the ability to be successful with managing those chronic conditions. While we're in the home, we're always assessing the patient's physical condition, ensuring that they're getting better. And if we're not seeing progress, then we would go through and, tweak what we need to do, so that way that person has the ability to progress with their medical condition. We provide what treatment is appropriate, and we would work with not only our team, but we would work with the patient's primary care team, and again, just really ensuring that the individual is getting the exact supports that they need. And we also help with assessing and either modifying or reorganizing the home for that individual. We want to make sure that people are in a safe space to be able to meet their treatment goals and get back to baseline. So that's the most important piece of some of the home health care supports. We do provide rehabilitation supports, for individuals for a variety of different reasons. Most commonly, it seems that, after a surgery is where a lot of the rehab is provided. But we're also providing it for, that happen due to medical emergencies like a stroke or, some sort of injury or illness. And we provide physical therapy, occupational therapy, and speech therapy right in the home. Again, it allows the individual to take the skills that they're learning from any of those therapies and be able to apply it to their everyday life in home versus having to learn something in an outpatient facility and then take it home, and where those skills don't always translate. So qualifying for home health services. So the definition is that you have to be homebound. Now, homebound is a very ambiguous term. And, in reality, it just means that it's a taxing effort, or that it's very difficult for an individual to get out of their home without the use of some sort of supportive device, without the use of, without the assistance of somebody else. So, as you can see on this list here, those individuals that are on pain medications may be considered homebound because you really can't drive when you're on some of those medications. But we also understand and encourage people to still be able to try to live their life as much as possible, to be able to, leave the home for, infrequently and through short duration, for different things that could help. It could help with their physical well-being, but it more likely than not really helps with their emotional state and their mental state. So that way they're in a good place to be able to do the exercises that are needed to get better. Again, people still need to be able to go to, important medical appointments, or, they need to, go to a grandson's birthday party, or, they go to church every Sunday, or whatever the case may be. We know that it may be very challenging, especially at the beginning of receiving our services, to get out of the house and do those different things. But ultimately, we want people to be able to live their life and, get the support that they need. So that way it's no longer a taxing effort for them to get out of their house. Again, it's getting homebound, quote unquote, again, just means that, it's just a taxing effort to actually get out of the house to do your normal everyday stuff. And that's why you need the supports from the VNH. Now, hospice care. So, hospice care is a service that is grossly underused in both Vermont and New Hampshire, especially compared to the national average of individuals. So, in Vermont, it's around 43% of individuals who utilize hospice care at the end of life. New Hampshire, it's a little bit higher at 49%. But it's a support that is provided for individuals with a life expectancy of 6 months or less. The care that is provided is palliative, or it's, to manage the symptoms that an individual has, and it's not to cure the individual. So at the point that an individual decides that they are ready to be on hospice care, they're no longer seeking any curative treatment. And our team consists of nurses, doctors, chaplains, social workers, and volunteers to be able to provide not only the patient but their loved ones, the individuals that are caring for that individual. Provide that support so that way the patient is able to live the fullest life possible right now versus there are some individuals that, when they receive curative treatment, they're not in a space to be able to, live their fullest life possible. And hospice really allows people to live the fullest life possible and ensure that they're able to, enjoy the time that they have left. So, these are some very general guidelines as it relates to qualifications for hospice. Again, like I said, they have a life-limiting condition that has been diagnosed for that they have 6 months or less left to live. There is continuous progression of the disease. The individual, the disease that individual has is progressing and causing, their life expectancy to shorten. Individuals that frequent the hospital a lot, whether through ER visits or become hospitalized, or even go and see their doctor on a frequent basis, could potentially qualify for hospice. Weight loss is greater than 10% over the past 6 months. So, an individual who weighed 200 pounds in January, by July, if they weigh 180 pounds, they've lost 10% of their total weight in the last 6 months. And if there's no reasonable explanation for that they hadn't been on a diet, they weren't, increasing their exercise, anything like that, that could be a reason as to why they may qualify for hospice. And, either the patient or the family, if the patient is unable to make decisions for themselves, may just want to focus on symptom relief as opposed to trying to cure that individual. And one other thing, also qualification for hospice, is that if somebody is falling down more regularly than not, that may also be a reason as to why they may qualify for hospice. And again, these are just some common diseases that qualify for hospice. There are far more specific parts of each of these diagnoses that would qualify an individual for hospice. But it's pretty safe to say that something, that's at an end stage for that disease would be a reason as well as for why somebody would qualify for hospice. And what does the hospice benefit cover? So, the hospice benefit cover, which is the hospice benefit covers a lot of things. And, for those individuals in particular who are on Medicare, it's an entitled benefit for them that, that their hospice supports are covered in full. There isn't a bill that the patient should receive or the family should receive after the person has passed away. Most private insurances also cover hospice. But again, once you get outside of the Medicare realm, that's a conversation that you need to have with the insurance company specifically to kind of go over what is available for the hospice benefit. But again, we provide nursing and home health aid visits, medical equipment and supplies that are needed based on the diagnosis for that individual, medications for symptom control. There are some instances where medical equipment or medications may not be covered, but again, that's a conversation that you can have with our social work department as well as our as well as the insurance company, and we can help facilitate that. But we also our social workers and our chaplains also provide support, and then we also have volunteers that provide a lot of additional support that the medical professionals or social workers or chaplains don't provide. And again, it's just a very well-rounded team that ensures that everybody, including caregivers and loved ones, are also being supported during this very challenging time for the individual. Speaking of the caregivers and loved ones for the individual, we do also provide grief counseling for them for a minimum of 12 months after the patient passes away. And I say minimum because we still have check-ins with individuals who loved ones have passed away 10 years ago, and we just want to make sure that everybody is is supported as much as they need to or want to be supported. And in addition to, we also assist with providing respite care for an individual, so that way the primary caregiver would be able to get a break from time to time. So so we work with a lot of hospitals and nursing homes and things like that to be able to provide support for that individual, and try to keep that individual as close to home, so that way family and friends can still go and visit them while they're in a short-term respite stay. And as I've mentioned, volunteering for hospice, ultimately, volunteers do a lot of stuff within the home for the individual to ensure that maybe the caregiver, the primary caregiver, has a chance to take a break, or it's another support for the patient, to be able to play games, or just be able to talk or listen to music, or whatever is needed for that patient. So we do a whole bunch of stuff, and in addition to that, we also have volunteers that don't necessarily want to go in the home to provide supports for individuals, and so they're able to do some of the admin functions here at the office to ensure that the rest of the team is feeling supported, that mailings or whatever get out on time, and things like that. So basically whatever your skill set is, we would be able to find a volunteer job for you within the organization. So, and you can go to vnhcare.org and find out a lot more about volunteering, as well as there's an online application that you can fill out. Now, long-term case management. So our long-term case management services are a support for individuals to be able to create a support system around them, so that way they are able to stay living in their home for as long as possible. We are able to coordinate the ability for personal care attendants to work with the individual, to take them to doctor's appointments, or to go run errands, or whatever the case may be, but also be able to provide some support within the home, so that way the home can continue to be maintained. The case management services that go with it really work to ensure that patient has all of the supports around them that they need to be able to stay in their home, whether it's ensuring that their Medicaid applications are up to date and have been submitted on time, so that way they don't lose their Medicaid benefits, or they help with fuel assistance or food assistance and things like that. And again, just on a regular whatever interval needs to be done, are ensuring that paperwork is being completed for that individual. So we can also help with assisted devices or home modifications within the home. Those still would have to be covered by insurance, or come out of the patient's pocket, but we can help with supporting getting those side of things taken care of. And then on the flip side, as the individual starts getting to a point where they need to live in a assisted living home or a nursing home, or whatever the case may be, we can help with that transition to get the person in the right living situation for them. But again, we'll do everything that we can to try to keep them living in home as long as possible. And, again, this is a very short list of things that long-term case management does. But at the end of the day, it's, the last bullet is the most important piece, is that it helps you remain at home and be as independent as possible. We're able to support the individual, potentially support the rest of the family that may also be supporting that individual, to ensure that they're able to be as independent as possible. Now, flexible choices is a part of the program that allows for the patient or a family member to self-manage the supports that an individual would get. And with self-managing of supports, it allows for just better flexibility to specifically around when a case manager may need to come out to the home. It could be the patient may prefer to have people at night, maybe on the weekends, things like that. And our case managers, while they try to be as flexible as possible, that may not always work to be able to do that. On the similar side of things, the patient and or a family member would be able to hire their own personal care attendants for the individual, which will allow them to, again, have greater flexibility of when those supports are happening. And again, looking at the possibility that maybe the patient prefers to go grocery shopping at night because there's less people, or there's something on the weekend that they really want to be a part of, or whatever the case may be, but we may not have the staff to be able to support them at night or on the weekends and things like that. So flexible choices just allows the individual or the family to be able to be more flexible with when the services are being provided to the individual, again assuming that there are people within the patient's life or the patient themselves that are capable of managing those services. And for those individuals who don't qualify for long-term case management, because there are some specific guidelines around, income and things like that, there is also an additional support called Help at Home, which is really just the personal care attendant side of things. There's no case management involved. There's no, support as it relates to, really helping with getting all those well-rounded services and things like that. This Help at Home support is more of, being able to run errands or helping around the house or things like that. And then the big difference with long-term care versus Help at Home is that Help at Home is a fee for service, and as you can see here on the slide, it's a private pay service, and the patient or the family or whomever would be responsible for covering the cost of the hours of support being provided, as well as mileage that would be used to transport that individual. There are some insurances that do cover these supports, but they're not as widely available as as we would like to see. So, if you have this, potentially you have the ability to have your insurance cover it, just really ensure that you've had a conversation with the insurance company to fully understand how much of the benefit can be utilized. And finally, we have our maternal child health program. And so again, similarly to all of the supports that we have talked about that are more focused for adults, our maternal child health care program really allows for those same supports for the kiddo, as well as the family members or the parents of that individual. To start this on the skilled nursing side of things, it's very similar to our home health program for adults. It's the ability to provide support in home for a child whose parents may not have the ability to drive them to outpatient facilities for appointments, or a variety of different reasons as to why they may not be able to take their child to an outpatient facility. So, but we also provide prenatal visits for new moms that have been told that it's potentially a high-risk pregnancy. We also provide support for the postpartum mother with a history of blood clots, diabetes, hemorrhage, and breastfeeding challenges. We really want to ensure that the child has the most success that they possibly can to thrive and to grow as a child. And we want to ensure that mom and dad have the skills potentially that they need, or the education to provide that support. So we do a little bit of everything as it relates to providing the skilled nursing for children. We also have an educational program called Strong Families, which the primary goal of the Strong Families program is to be able to educate new moms, and this is a mother-centric program that provides them with training and education, so that way they can provide the best support to their child. And we've had brand new moms who have never had children, and we've had moms that are on their third kid, and they want a refresher course, quote unquote. And this is a program that it's 25 different modules of education for a mom that that we go through from the time the child is born until they reach the age of 2. It may not take 2 years to go through everything, but that support is available for new moms for the first 2 years of the child's life. And finally, we do have a pediatric palliative care program. This is offered to children under the age of 21. Our definition is anybody 22 or older would be in the adult program, and 21 and under would be in the children's program. Unlike traditional hospice care, the child can still receive curative treatment. Like I had said originally, for adults with hospice care, is that they would not be able to receive curative treatment. But the diagnosis is also different. It's that the child has been diagnosed that they won't live to see their 21st birthday, versus having 6 months less or 6 months or less to live for the adults. And again, it's almost identical to our adult hospice program, except the individuals within this program are trained specifically to provide supports to children. So again, it doesn't matter how old the individual is. Quality end of life care can be provided at any age. And for anybody who is watching this presentation, if you have any specific questions, all of my contact information is here on the screen. Feel free to reach out to me by phone or by email, and I'm happy to answer any questions that you may have as it relates to any of the home health and hospice supports that Visiting Nurse in Hospice for Vermont and New Hampshire provides. I do want to thank everybody who has watched this live, and please feel free to share this to everyone that you can think of that may need some supports within the home. And also check out our other videos. There's a video regarding Hospice 101 that will be available, as well as talking about advanced care directives and our chaplaincy program. So I want to thank you all again for watching this video about introducing you to what home health and hospice services are available to you within the comfort of your own home. Thank you, and enjoy the rest of your day.